It's been 3 weeks since I saw her last. There was an immediate improvement on the knee from a mobility point of view, but in 3 weeks now we can have a little bit more proper feedback. Can you explain how it's going and which kind of a test or which kind of activity you did?
Yeah, so usually I have issues with my left knee, so I've been doing a lot of different activities. I've been doing strength training, kind of heavy lifting, but also doing a lot of like acro yoga, aerial yoga, all different kinds of yoga. And yeah, not had any issues with my left knee, so that's been really good.
She was saying a little bit, a tiny shoulder pain. Stay like that.
There's a bit of a shoulder issue with like anything overhead.
Anything overhead. Now. So this shoulder moves better than the other. So it's more flexible this side, okay, than this side, okay? This side is a lot more tender than this one. I already checked, I already know. How old is the injury on the hip, the car accident?
Long time, 20 years.
20 years. Now, I will show you, I already checked, so I'm sure 100% there is an injury here now because she was run over by a car.
Yeah, it was just it slowed down, but it was just a slight bang.
A slight bang on the hip. This is what can be felt today. I will open the camera from another point of view and we will see which kind of test I will do in a patient like this. This is the pelvis. You can definitely see the difference in the shape of the left leg, which look a little bit more straight, and the right leg, which looks a little bit more rounded. Now, if I do a test locally, you can see that my hand can move here the hip very easily, and the other one, this is where she was run over. It's a lot harder. So all the tissue here are a lot harder than this side. So there is a misplace. If you look now, I pull one leg. Okay, I pull the right one, and now I pull the left one. The left one cannot be pulled at all. So when I pull this leg, the pelvis goes down. When I pull this one, it doesn't move at all. Okay, this is the superior anterior iliac spine. This part, if I grab it and if I pull down, it doesn't move at all. If I do it the other side, it's already lower. There is a little bit of mobility. Okay, now I will change the point of view and we will see all the body. Okay, just a quick summary. I already checked. I usually start here, as I always tell. This area, what's going on? All the movement of the skull rearranged around the left frontal bone. I'm here, this frontal bone moves toward this one. This one could have been completely still, so problem there, or it has a rhythmic motion anyway. So I already know it's not the skull. I need to find an area of the body that is connected, particularly connected with this one. You need to know, again, the skull and the pelvis, they reproduce the same movement. So this part is around the hip, left hip. She confirmed she had an accident there, a car smashed on the left hip. Now, the knee is completely fine, a little bit of pain, and this pain is there for a few years. Right shoulder. What's going on? And what's going on you? It's the same. You do the test. This one moves backward a lot. This one is more stuck. Difference if I depress the shoulder. Try to feel this now. Try to see. Very light on the right, very heavy on the left, because all the upper part is already twisted like that. Why it's twisted, I already know. The problem comes from there. I need to convince the patient that I'm doing right. So I can do a bunch of tests. For example, the neck here is a little bit more soft than the left side. What is important is, if you have an impingement of the shoulder, this is the classic presentation. The shoulder is a little bit forward, the supraspinatus, which is usually the most frequent muscle to be irritated, inflamed, and then damaged over the time. It can take years, it can take ages. She said that injury there has 20 years. Okay? The setup of the body, twisted, this shoulder forward, it doesn't go backward, this one goes backward, body completely misaligned. And then this muscle, we can think, okay, probably there is a difference. There is. So the muscle is pulled, it gets inflamed, and over the time it gets the anatomical damage. What can I do? I can only listen to the body that wants today an improvement here. So if we go a little bit higher, this side and this side, there is a little difference, but if we go here, I really cannot lift this area of the leg. It cannot be lifted. This one is very, very light. This part looks more natural, more soft. This part is a lot harder. I will show you a close-up of it. And that's it. I need to treat here. The spine moves a little bit more. Is more tender left to right, right to left. Is more flexible. So I already know this is the treatment today. I will treat, open the camera again, and we'll see if there is more balance around the area which is painful. So the treatment ended. It didn't last long this time. There is a big difference in the mobility. I already checked the shoulder as well. There is another injury that it needs to be treated next time. Sometimes I can do twice in the same session because I usually treat around an hour. Let's check. So I lift this side and I lift this side. Now this side is a lot lighter than this one. Okay, so completely changed. The tension is completely different than before. So now this leg seems more relaxed, the muscle is more soft. This one a little bit harder now because there is another injury which we don't discuss now. If I lift this side, it's a lot heavier than this side now. So the posture completely improved, completely changed. Is an improvement because that was an injury, and the injury clearly is not is not there anymore. Okay? What do I feel here and why that things should make a difference on the shoulder? So the mobility left to right of the spine is a lot different. But obviously, if she came now for the shoulder, at the shoulder level, it has to be a difference. Okay? This side is a lot lighter than before. So before, right side a lot lighter, and this one was a lot heavier. So this side is lighter, this side is heavier than before because they are more similar. This side of the neck, side flexion of the neck was more stiff. Now, this one is better, and this one is harder. So the condition changed completely. The pelvis twisted, this top is more balanced, but there are other things to treat. I go here, the mobility I already checked is completely different. There is something on the other side. I need to find it. I will check next time. It can be some injury on the other hip, can be some injury on the leg, who knows? Okay. On the frontal bone, there is a difference. So if I now push this side and this side, this one became more strong. So the change in the posture happened everywhere, even on the skull. So the skull has a mobility, so you realign a little bit. And this side, if I push here, this side is definitely harder, you feel?
Yeah.
Now it's almost harder on the right. Before it was harder on this side. So I just treated that, I didn't do anything. Then stay on the leg, try to find a position of release, position of ease, and then there was a kind of a click on the other one, the pelvis changed, And then I retested, everything changed. The spine, the pelvis is completely different, this part is different. It's still not completely loose. This girl played a lot of sport. I'm sure she had a lot of injury. So I will check next time because the body needs time to rearrange. Definitely now is more interesting this side of the body. I will check, I will try to understand what's going on. And next time I can treat. It can be even the neck, because the neck now, you feel? Hard?
Yeah, it's really tender on this side.
It's tender because it moves a little bit different.
Yeah,
but yeah, I need to find a place in which the neck doesn't move. So if it's the neck, you can see the head is not completely straight. It's a little bit like this. Yeah, the jaw is a little bit on this side. So it may be the teeth, but in this case not, because the jaw is able to move left and right quite easily. It should be the neck. It looks like it's the neck. The neck has a massive influence on the lumbar spine, so a lot of lower back pain comes from the neck. This one can confirm the neck is very stiff. The spine, the lumbar spine, because she also, when I was treating, she started feeling pain on this side, yeah? The lumbar spine, it moves a lot. If it moves only on one side, even only on one side, there is nothing. To have a mechanical problem, the spine needs to be blocked. The only part of the spine that usually is blocked is L1, L2 due to pelvis operation. So if you have pelvis operation, cesarean, appendix, hernia, so any kind of operation here, you will have L1, L2, which is not the case. It's not the case. Okay? It moves very well. If you had an operation there, I do this test, you will jump from the pain. L1, L2 will be stuck, and this is the most frequent restriction on the lumbar spine. The rest is fine. I already know it's not the lumbar spine. I will check, I will try to understand, maybe, I don't know, some rib, something on the head. We will see next time. For the moment, this one can improve or not, but definitely is more balanced. So we need to achieve a position of the body which is completely, I don't want to say completely, but more equal, left and right, all the mobility, side flexion, the neck has to be more, the head needs to be more straight, because look at the jaw. So the head is like this, okay? So the neck now is the first things I will check next time. Thanks for watching.